So Corventis is a company that is trying to reduce worldwide healthcare costs, at the same time providing better care. In society these days, we find that because of the aging populations and populations are coming online capable to pay for healthcare, there's a growing demand for healthcare. On the other hand, since the supply of healthcare is relatively constricted, the costs of providing care are in fact going up. Corventis is trying to address this simultaneous goals of providing better care and reducing costs by introducing technology specifically into the mix in the form of internet communications and wireless communications in providing better care. Specifically, we do this by managing the patient remotely, continuously, and providing data in a continuous manner to the physician so that the physician can use this data to intervene ahead of a clinical event actually happening instead of reacting to it after it happens. The system has three components in order to make this care delivery possible. The first piece of it is called the PICS. It's an adherent device that looks like a large band-aid. The device is actually fairly sophisticated for a fairly simple looking device. The device is kind of placed on the patient's chest, very much a way the patient will put on a band-aid, and at that point the patient becomes wirelessly connected to the internet. The device itself is capable of making a number of sensor measurements, whatever physician typically needs to understand what the patient's health condition is at, and the data is transmitted wirelessly regardless of where the patient is globally to our servers, which is the second component of our system, and in those servers the data is collated and organized. We also have very advanced algorithms that are available to crunch through this data and identify patterns that enable us to understand which patient is going to be in trouble and which patient is not in trouble. And for the ones that are going to be in trouble, we are able to pass information along to a physician who can then interact with the system through a web-based interface. It's the third component of our system. Understand which patients are going to have what sort of problems and intervene proactively. I believe that the United States is the best place to start a technology company because it offers a unique blend of access to capital, capability to provide intellectual property protections, access to individuals and competencies across the country that are highly astute and understand the domain very well, and also an interesting and very large market and the capability to pay and commercialize within this market to bring new technologies to fruition. So innovation to me is an abstract concept. It really hinges on the capability to see what others don't see, so to say the capability to see around the bend, around the corners. More often than not, when you try to solve a problem that is staring at you in the face, there'll be plenty of people to tell you why it cannot be solved and all the different reasons why the approach that we are taking to solve the problem is not workable. Innovation is closely coupled with the determination to succeed, the capability to kind of see things through, despite objections that others might bring as valid objections, but nevertheless the solution might have eluded them. So I think one of the key things that Corventis is trying to do is to provide better care at lower costs in the arena of healthcare. I think these are contradictory goals that a number of different people are trying to solve, and I think Corventis is taking a big step in bringing technology and technological solutions in the form of preventative care of patients with chronic disease. And if we execute it right, we believe that we in fact can make healthcare affordable to a much greater level than it is today.